The Los Angeles County Department of Children and Family Services established the Visitation Centers to enhance our efforts in unifying children and families. Visitation is primary, one of the primary factors of unification. We realized that we had to come up with a plan to facilitate these visits, and our office had a program where we have outreach to our community and our churches, and with this partnership with our churches, we were able to come up with the plan of the Visitation Center. And again, that was to facilitate the visits between the children and the families and to have a home-like environment. And the churches were really willing to step up and work with us in this area of visitation. It's important that families have a safe environment to meet, an environment that is safe, an environment that is a home-like environment. It improves the quality of the visits between the children and their parents, or the children and their siblings. Situations where the children have been abused in their homes, either physically abused, neglected, domestic violence, we have sexual abuse cases, just any case or any family where we find that a child is unsafe in his or her home, and it necessitates our having to remove this child from their parents' home. We would utilize this facility for that purpose of having family visitation. One of the benefits of the Visitation Center is that it is really a very home-like setting. We have our kitchen, we have our dining area, we have our living room area, and then we have a little area that has all of the children's books and toys for different ages. So it's very much like a home setting, which makes it so much more comfortable for the children and the families. Because it's a home-like setting, because we have a kitchen here, the parent is able to cook dinner for their child or their children who they're visiting with. They're able to have dinner here, they're able to work on homework together, they're able to read books to their children, sit in the living room area, and it is private, and that just allows for a parent to be able to read a child a book without having to worry that others will hear or there's too much noise around them. There is that ability to, just to dance with their children if they want to put on some music and dance with their kids, or just sing a lullaby to their children. That is the benefit. Our whole goal is to really enhance the quality of the visit, and that the visit is so much more enhanced in this setting rather than either an interview room that we might have in our office, or a park, or a Burger King playground, or McDonald's. The visit is just enhanced so much more when it is in this environment, because it feels like home for the family. The cost of the Visitation Center has been minimal. We spent approximately between $4,000 and $5,000, and the church donated many of the items that are here in the Visitation Center, as well as our community. Some of the results that we're seeing is that families are reunifying faster. We are seeing, and statistics just prove that families that visit are more likely to reunify. And we are seeing that, and we are finding that to be true, that the families who are using our facility are reunifying with their children. Parents are more motivated to comply with court orders and complete their program so that the children can safely return to their home. And because we've had monitors who are consistently visiting or monitoring these families, we know that these children are safe with their families, because we have observed their interaction. The South County Department of Children and Family Services is proud to have been a recipient of the CSAC Challenge Award.
Los Angeles County created the Plain Language Initiative to promote better communications in easy-to-understand terms. Government documents are notorious for being very, very complicated, very bureaucratic. I think they feel they have so much legal information that has to be in each and every document that it literally makes it impossible for the layperson to, you might be able to partially read it, but you clearly do not understand it. Plain language is the language that is written and spoken so that it is easily understood the very first time you read it or speak it. The Plain Language Initiative in Los Angeles County has been totally and completely embraced by each and every department. So we have 37 participating departments, as well as 5 supervisorial districts. We promoted the initiative in many different ways. We started massive training. We started a major poster campaign, distributing 4 posters a year for the next 4 or 5 years. We also provided software and really took charge of the entire initiative, starting with we support plain language written on all of our documents. We knew that plain language was going to be something new, and I think with our campaign we really made it exciting to learn something new, and by providing all the resources that were necessary to be successful in plain language. We started with a writers network. These individuals were identified by their department heads, so we had one representative in every department. We brought them into training sessions. We supplied them with the software. We supplied them with the high-profile awareness posters. We provided all of the tools. We made them literally the subject matter expert within their department. Therefore, they became the go-to person. So if you had a question on how you wanted to translate a document or how you could better add clarity to the documents that you were writing, you had a person, a resource in your department.
During our H1N1 response, we had our plain language principles at the forefront of anything that we created. So having departmental standards, for example, of keeping audience at the forefront of any of the communications, making sure that our content was organized in a way that was logical and aesthetically pleasing. All of these things really helped us communicate our messages during our flu response. We really had no clue how the flu was going to evolve over time, so we knew we were dealing with a very sensitive topic. And it's known that during emergencies, people retain less information, and so plain language really helped us limit the number of messages that we were sharing and really making them actionable. So letting people know what they could do to protect their health.
I think that our overall greatest success of the Plain Language Initiative has been in these last 6 years, that we have really been able to successfully communicate more clearly with the public. And we can demonstrate this by the documents, by all of the brochures, by our websites have changed, by the responses that we have gotten from the public. The first, when they need the information, we want to be able to deliver clear, plain language that they can easily understand the first time they read it. The Quality and Productivity Commission of the County of Los Angeles is pleased to be a Challenge Award recipient from the California State Association of Counties for our Plain Language Initiative.
The Full Service Partnership Program is a comprehensive set of services and supports for 4 age groups: children ages 0 to 15, transition age youth age 16 to 25, adults age 26 to 59, and older adults ages 60 and above. Full Service Partnership programs really serve the most challenging clients and clients that haven't been served prior in our mental health system. So we've made we've outreach to clients, we've brought them into services, we have demonstrated that this approach reduces hospitalizations, incarcerations, and homelessness, have increased a client's quality of life. The phrase "whatever it takes" is kind of the mantra for the service approach. Up until really the Mental Health Services Act was passed, we didn't have many services at all for older adults, and they were really a population that had not been served, with the exception of emergency services. There is still a huge stigma around seeking mental health services and not just kind of gripping down and saying, I'm going to going to be okay and I'm going to work through this. So what's unique about these services is that they provide a comprehensive set of services and supports for individuals as they recover from mental illness. The typical FSP team is comprised of a psychiatrist or some portion of the psychiatrist or nurse practitioner, so someone that can prescribe medication, usually a team leader that more often than not is a licensed individual. You'll oftentimes have a therapist of one form or another, a social worker or a psychologist. You'll have a peer advocate, so someone, and this is in the adult system of care or even in older adults, you'll have a paid peer who helps clients and acts as a role model for clients to get better. You oftentimes have a housing specialist as well as an employment specialist. Within an FSP program, there are many types of support that a client will receive that goes beyond medication and therapy. Some of them relates to if a client can't get to a health clinic, for example, for their health appointment, the team certainly could drive them or help them take public transportation. If a client has just moved into an apartment and is having a hard time, there's a lot of support around living independently for the first time that can be provided, including a peer advocate staying for part of the night or things along those lines, as well as budgeting, going to the market and helping people make healthy food choices as well as economic food choices. In terms of the number of clients seen in LA County, I would have to, a guesstimate is about 10,000 in a particular year of unduplicated clients across the 4 age groups. I know adult is almost up to 5,000, for example. So it's somewhere between 8 to 10,000. We find dramatic reductions in homelessness. We've seen increases in the number of clients that live independently in transition age youth, in adults and older adults. Dramatic reductions in psychiatric hospitalizations, both in terms of the number of days someone's hospitalized and the number of people that actually wind up being hospitalized. Incarceration is the same thing. We're seeing reductions in the number of people incarcerated as well as the number of days, reductions in the number of days incarcerated. So we've seen many graduations from this program, and in the process we have realized that everything we have saved, we've saved in one case for adults and older adults $39 million in terms of what would have probably been spent on psychiatric hospitalizations and jail mental health episodes.